Hey, skincare advocates and clinical caregivers. So, have you ever seen a patient frustrated by chronic itchy patches of skin that just keep coming back? You may be looking at psoriasis, a complex autoimmune condition that affects more than just the skin. Today, let's unpack the science, explore the treatments, and focus on how nurses can help patients find both relief and confidence. Psoriasis is a chronic autoimmune inflammatory skin disorder where the immune system mistakenly attacks healthy skin cells, accelerating the skin's life cycle. This leads to hyperproliferation of keratinocytes, causing thick, scaly plaques. Inflammatory cytokines like TNF-alpha and IL-17 play a major role, making psoriasis not just a skin disease but a systemic inflammatory condition. Let's take a closer look at the common types and clinical presentation. Plaque psoriasis, which is the most common type, shows up as raised red patches with silvery white scales often on the elbows, knees, scalp, and lower back. Guttate psoriasis features small, dot-like lesions, often appearing after a strep infection, and it's pretty common in children and young adults. Inverse psoriasis presents as smooth red patches in skin folds, like the armpits or groin. Pustular psoriasis is characterized by white pustules on red skin, which can be either localized or generalized. Erythrodermic psoriasis is rare but life-threatening, with widespread redness, scaling, and systemic symptoms. Symptoms across these types can include itching, burning or soreness, skin cracking and bleeding, and even nail changes like pitting or onycholysis. Alright, let's talk about medical management specifically: topicals, light therapy, and systemic treatments. For topical therapies, corticosteroids are considered first line, and vitamin D analogs like calcipotriene are often used as well. Other options include coal tar, salicylic acid, and of course, good old emollients. When it comes to phototherapy, narrowband UVB or PUVA, which is UVA plus psoralen, are commonly chosen for widespread disease. For systemic therapies, biologics such as adalimumab, secukinumab, and ustekinumab are available, along with oral agents like methotrexate, cyclosporine, and apremilast. Just a quick note, treatment really is individualized with severity, comorbidities, and patient goals all matter. Now, moving on to nursing care and patient education. First, it's important to help patients maintain skin integrity. Encourage daily moisturizing, make sure topicals are applied correctly, meaning a thin layer on clean skin, and remind them to avoid harsh soaps and hot water. Always monitor for infections or worsening lesions too. To relieve pruritus, cool compresses and antihistamines can be helpful, and it's also key to teach proper scratching alternatives to prevent trauma. Addressing the psychosocial impact is just as important. Psoriasis can lead to anxiety, depression, and even social isolation. It's vital to provide reassurance, normalize flare-ups, and connect patients with support groups or counseling if needed. For patient education, help them identify and avoid triggers like stress, alcohol, skin trauma, and cold weather. Emphasize the importance of medication adherence, even during remission, and teach them how to recognize early signs of a flare and when to follow up. So the bottom line is that psoriasis is more than just skin deep, and so is our care. From cracked skin to cracked confidence, psoriasis really affects patients in every layer of life. As nurses, we provide more than just treatment. We offer support, dignity, and hope. Have you helped a patient manage psoriasis successfully? Feel free to share your favorite strategies below. And don't forget to like, subscribe, and follow for more dermatology-focused nursing insights, where compassion meets clinical care.